Hello everyone, so I am back with another video on my YouTube channel Lectures Online, and this video is about the COVID-19 treatment again. In my previous video we have studied about the COVID-19 treatment, the treatment of the patients who are at home and who are considered as an outpatient. Now those patients who are suffering with a severe infection, they are obviously considered as an inpatient. They have to stay at hospital and treated well, because in severe cases, you know that the patients are mostly suffering from severe acute respiratory distress syndrome or middle east respiratory distress syndrome. So in that cases it is very necessary for the patient to get oxygenated and to make the patient comfortable with his or her symptoms. Now before going into the detail of this video, let me tell you that all of the content that is available on my on this video and my previous video, it is from the up-to-date article, and I will post a reference link in my in the description of this video, so that you can get the point from where this information is coming. And obviously in this situation of panic and when there is not enough information about the treatment of COVID-19, reference point is very important. And some of you have asked me about the reference, so for the reference, please go to the subscription and find out the link. Now let's move on to the hospital care of the patient. Now, as you know that the patient is suffering from COVID-19, he has severe infection, so he obviously will have difficulty in the breathing. Now the three things are important here. The first thing is that the patient who is going to be considered as an outpatient, he or she have severe disease, right? Now for this patient to be admitted to the hospital, you have to be very cautious about the appropriate infectious control. Now appropriate infectious control is very important because this infection is very contagious. And when we were studying about the home care, you also studied that how you have to manage the patient at home as well, because this infection can transfer from one person to another. Now after the appropriate infectious control, supportive care is very important. Now supportive care is here, it is very important because there is no proper treatment of the coronavirus. So the only thing you can provide is supportive care to the patient, because your patient is suffering from SARS or MERS. That means your patient is having very difficulty in the breathing. So you have to make it easy for your person to breathe properly and to cope up with other symptoms. Now first thing that you have to consider in your patient is oxygenation. Now proper oxygenation is very important, and for the purpose of oxygenation, first you can either go for you will have high flow oxygen and non-invasive positive pressure ventilation. This is the first thing that you can carry on, but the exception lies here. The patient who is suffering from the severe acute respiratory syndrome and the patient who have very much problem in the breathing, then you will go to the intubation with mechanical ventilation, and you will also go for the extracorporeal membrane oxygen, especially in the patient who have refractory hypoxia. So this is all the things that comes in the oxygenation. First you will go for high flow oxygenation, non-invasive method. Then you, in the patient, in case of more severe cases or the patient of SARS, you will go for intubation and with the mechanical oxygenation. Now coming to the next point, oxygenation is the primary thing that you have to consider in your patient. Now we know that there is no proper medication, no antiviral is there for the treatment of COVID-19. So the research is being carried out to find out which agent is effective. Now talking about the glucocorticoids, basically glucocorticoids are found to be effective, but now it is said that do not use these glucocorticoid in COVID-19 patient unless there are some other indications. Now what can be the other indications? There can be the coped exacerbation. For example, if there is coped exacerbation along with the COVID-19, then you can use this glucocorticoid, but you should not use the glucocorticoids only in the COVID-19 patient, because these glucocorticoids increase the mortality in the influenza Now, these are the obviously evident facts that these glucocorticoids increase the mortality in the influenza patient and decrease the virus clearance in case of Middle East respiratory syndrome. Now, because of these two things, you have to be cautious about the use of glucocorticoids, and don't use these glucocorticoids unless the patient have other indication, for example COVID exacerbation or the condition where the use of glucocorticoids is important. Now moving on to our third thing, that is the NSAID. Now the use of NSAID, acetaminophen, all of these things, there is no evidence that support the use of NSAID in the patient of COVID-19, but there is evidence of increased mortality in the patients who are using the NSAIDs. Some of the doctors replace NSAID with acetaminophen, but let me tell you that acetaminophen do not have any significant effect in the treatment of the patient, so you should not go for NSAID or the acetaminophen. Number 4 is the investigational agent. Now you know that in order to find out the correct treatment, there's so many research, so much investigation that is going on around the world, and there are some of the agents that are found to be effective, but still they are in the clinical trial. These are those agents. First of all, there is the remdesivir. Now this agent, basically it is a nucleotide analog, and it is found to be effective, but obviously it is in clinical trial right now. Then there is the tocilizumab. This is the interleukin 6 inhibitor. Now interleukin, these are the agents that are involved in the inflammatory process. And then there are lopinavir or ritonavir, that are the protease inhibitors. All of these 3 drugs are found effective, but still they are under the clinical trial, that whether they are effective against the COVID-19 treatment or not. Then there comes the chloroquine or hydroxychloroquine. Now in the China, it is said that these 2 drugs are effective, and there are some publications that support this evidence. But obviously it is not clear, and it is I think it's the most controversial drug right now. Chloroquine and hydroxychloroquine, they use during the treatment of the COVID-19 patient, as it is not approved by any body, any authority, so you should not use these drugs in the patient of the coronavirus. So all of these 3-4 drugs, they are under the clinical trial and are not approved yet. So this is the conclusion, that the patient who is in the hospital and who is COVID-19 positive, you have to consider him seriously. You have to take appropriate infectious control, supportive care, oxygenation, provide oxygenation, either non-invasive or invasive. Then you should go for the supportive treatment, but you have to avoid the NSAIDs, you have to avoid the glucocorticoid as much as possible, and you can go for investigational agents that are approved in your country for the practice or for the investigation. So this was all about the hospital care of the patient who is suffering from the severe infection of COVID-19. For the rest of the video, stay tuned to the lectures online.